My pain started about December 2012. I was on deployment to Afghanistan, and I was doing some training, and that's really when I first remember it starting. It felt like someone stabbed me right in the stomach, and then just shut down my entire right side of my body. Especially the unit that I work in, I mean, running and lifting and physical activity is a major thing. So once I couldn't do that anymore, I became useless to them. I'm actually getting medically discharged from the Army because of the pain. I was getting threatened to get kicked out of the Army. I couldn't run, I couldn't walk. I'm married, so I would come home and I couldn't do a lot of activities that my wife would want to do, and it just affects your everyday life. Walking the dogs, you can't do things like that, and then you just kind of get down, kind of depressed, and you just don't see like, hey, how am I gonna survive with this pain for this long? I'm only 21, so I'm thinking, I got 60, 70 years to live with all this pain.
The scariest point of the procedure of all of this was when AJ came back from Ranger School. He thought that he had ripped a hernia, or he didn't know what had happened, but his entire pelvic region was swollen. His abdomen was swollen. He couldn't get out of bed. He couldn't get up to eat or to drink. He couldn't go to the restroom himself. And he was taking just bottles of tramadol for pain relief. And that's when I really got scared.
Before I met Dr. Powell's, really I just used pain medicine and, really just dealt with it. I didn't really think there was a solution. My pain levels were about a 7 or an 8 if I wasn't on my pain medicine, and sometimes worse. There was days I couldn't get out of bed. I would have to just call and be like, hey, I can't get out of bed right now. I took a variant of tramadol and then Percocets for a little while, and at one point I was taking about 6 tramadol and then 2 or 3 Percocets a day. I went to Dr. Chang in Columbus, Georgia, and he was like, hey, I do see you're in a lot of pain. You have all the signs, but the guy I recommend is Dr. Piles because he really knows, and he kind of pretty much invented the stimulator. I wasn't excited about having to drive 7 hours, but it was worth it for sure. The first day I got here, he was really the only one that would take in and understand what I was talking about. Everyone else was just like, oh, I don't think anything's wrong, because I dealt with this for 2 years before. I had the surgery in July of 2014. I dealt with this for 2 years, and they were just telling me nothing was wrong. And then I came here and he was like, he hit me with he got a rod and he poked it, and I was like, yeah, right there. And he was like, yeah, that's exactly what I think is wrong with you. He came in, it was really fast procedure, and he said, I'm gonna put one of these stimulators in you. He just grabbed a needle and he stuck it in where the muscle was. It was fairly painless, and then he just hooked me up with a like a pre-battery, not on the end, the battery wasn't inside of me, it was just on a belt. He just hooked them up, and then instantly, about 5 minutes later, I could feel like it just loosened my muscles up and loosened the nerves up, and I was like, hey, I think this is gonna work. Because I was, that same day I was out, I was trying to do some, leg exercises and move my leg that I hadn't moved in about 2 years the way I used to be able to.
Seeing his reaction for the first time was amazing, because that day he got out and walked to the pool, and he sat out by the pool. He couldn't get in, of course, because, of the procedure. But he was walking around, I don't even think he took his pain medicine that day. He felt better already just from the trial, and it was a relief.
My pain before and after. So before, I was barely able to run, like I told you. And then after, I was, unless I had the stimulator off, I felt no pain. I was at 99% heal. It was great. Almost, within that same day, I instantly felt pain relief. Right now, I'm back in the gym. I'm throwing up weight I used to throw up. It's really no change. I do keep it cautious because I had the surgery not too long ago. But other than that, it's like I was back to normal. Yeah, every once in a while, I'll remember I have this in. I'll calm down a little bit. But other than that, really no restrictions.
Our lives have gotten back to the way they were before he was injured. We go to the gym together every morning. He's lifting just as much as he was before.
I don't take any medicine now. I've completely stopped the medication, and I just use the stimulator. I've showed him my gratitude all the time. I told him, this has pretty much saved my career. This will enable me to be able to do pretty much whatever I want to do again, and I really appreciate what he did, and hopefully more people come here and they can actually see how much this can help them, and that they don't have to live with pain like I was for so long. I wish I would have came sooner.